My name's Tony Landry. I served 6 years in the U.S. Navy and left the military with some back injuries and went through all the opiates and prescription medicine that the VA gave me, and finally found some relief with cannabis, and I was able to avoid all the other medicine. I'm reading from the UN Right to Health fact sheet number 31. In 1948, after all the atrocities of the World War II and the human rights violations and all, the UN came up with some basic rights to health that humans were entitled to. Part of the entitlements include three main points: the right to a system of health protection, providing equality of opportunity for everyone to enjoy the highest attainable level of health; the right to prevention, treatment, and control of diseases; access to essential medicines. So what we're talking about here is basically we're talking about regulating their health, off-duty use health. Nobody's promoting possession or use of cannabis on the job. For instance, if you had a police officer that got into a traumatic event and got TBI, if we're going to prevent police officers from using cannabis in off-duty hours, then we're going to be affecting their right to health. Israel just came out in 2017, cannabis could treat traumatic brain injury. They took rats and gave them TBI, and noticed a high level of 2-AG, which is part of our endocannabinoid system, was found in those rats. So they develop in a nasal spray when somebody gets injured in combat or for anything. If you have TBI, they give you this nasal spray of THC. It's a neuroprotectant. It helps you protect against further nerve damage. So by eliminating that option for our police officers and firefighters and EMT, we could be drastically affecting their health for long term for unscientific reasons. Mr. Juge says he wrote this policy in 1989. The endocannabinoid system wasn't even discovered until 1990. Since then, they've had a miraculous amount of studies done on the benefits of this. So what we're doing is we need to determine safety-sensitive jobs. Is a cook using hot grease, is that a safety-sensitive job? Should we ban the cooks from using cannabis? Is a pharmacist that's measuring fentanyl out, is that a safety-sensitive job? Well, what about the pharmacist that's measuring out cannabis? Is that safety-sensitive? So there's going to be some determinations individual employers are going to have to make on what are safety-sensitive jobs. You can't just put a blanket policy, statewide policy on all these employees. Individual employers are going to have to decide what's safety-sensitive. And this Title 23 needs to be, seriously looked at right away, because Delta-8 THC derived from hemp is very non-psychoactive, give you a little relaxation. So you could actually get fired just using something legal that's just as legal off the counter. These are unscientific methods that we're using to fire people and affect their whole life. They just need to be looked at and ended. Really, it really needs to be ended.